most notorious, famous public insurer, Medicare, they deny claims as well. It is part of the system. It's just a question of whether insurers are abusing that power.
So what are the real world results for people who experience a denied claim?
I mean, there's a few different ways that somebody can approach it. I mean, folks can pay the bill, which could result in you wiping out your entire savings. You could try to fight that claim and appeal it, maybe go to court. That again is also going to largely drain your savings if you actually have to go to court. Or you go into medical debt. Those are really the only ways out of the system at this point, and that's why people, I think, feel so powerless.
Well, even after major reforms, it's clear that lots of people feel that the healthcare system isn't working for them. How does our system compare to other developed nations?
Well, most other developed nations do not rely on private health insurers to provide their health care. They have a single payer system. And I mean, that is the biggest difference, is we depend on companies like United Healthcare to provide our health care.
What else is driving up costs for these companies?
I mean, every part of the system is driving up costs in some ways. I think a really illustrative way to think about this is like a prescription drug. So say somebody goes to a pharmacy and they're told they have to pay $200. The insurer is going to tell you that is the drug maker's fault because they set that cost for that drug. And it is true. They could lower the cost of that drug, you'd pay less. But if somebody with insurance goes into a pharmacy and is told to pay $200 for a drug, that means that they have skimpy insurance. It means that either they're being told they have to pay co-insurance, which is a percentage of the drug cost, or maybe they have a deductible where they have to pay the entire amount until their insurance kicks in. So it's everyone who's at fault.
So what are some of the potential fixes that could mean fewer denials, better coverage, and cheaper care?
Well, that's the million-dollar question. I don't think we've actually gotten there yet.
Even after all of the political capital that was expended on Obamacare, still we haven't figured it out.
It's important to note that Obamacare did strengthen patients' abilities to appeal these denials. That was supposed to be a big piece of this, and honestly, that is one of the more powerful things that patients can do to fight back against these issues. There are proposed fixes like the doctors lobby, the American Medical Association. They've been pushing for reforms to something called prior authorization, which is one of these tactics that insurers use. Those arguably could help, but I don't think we've gotten to a place here where we've fully figured out how to make this private system work and not also create a lot of pain for the folks that have to pay.
Were you surprised by the reaction that we witnessed online after the shooting death of the CEO?
Yes and no. I don't think I've ever seen anything quite like that. I think we're sort of used to at this point, discourse on X, formerly Twitter, being a bit toxic at times. Folks seem to be empowered to say what they want to say on those platforms that they wouldn't say in public. But I mean, when I wrote this story, the amount even of vitriol that I got just for saying we shouldn't be calling for murder of CEOs was astounding. People are furious. I don't think I've ever seen anything like it. I sort of expected some toxicity around the edges, but it is widespread right now on that platform.
It's an indictment of the times in which we live. Nick Florko, thanks so much.
Of course, thanks for having me.